Hello, good afternoon, everyone. Today we will be looking at introduction to variables in research. This particular lecture is for students in community health sciences, public health, even nursing. Okay, so I'm by name Eze-Ara Ronyenka, registered community practitioner, primary healthcare tutor. We shall be looking at this concept variables. And we're going to use 4 different examples to explain the variables. Okay, so let's begin. Okay, we have 3 types of variables we are going to focus on. One, the independent variable, the dependent variable, and the confounding variables. These variables are very much important that you should know about them in career research, especially in public health or in community health sciences. Okay, so we're going to look at them critically now. The first we're going to look at is the independent variable. The independent variable represents the factor being studied. Independent variable represent the factors being what studied. That is something that you are interested to study on. You want to study. Okay, let's say you want to study the knowledge of somebody on something. That knowledge is the independent variable. You want to study the person's knowledge on family planning. That is the independent variable, the knowledge. And it is the variable that is being manipulated. It is the variable that is being manipulated because it can be increased or decreased. Let's use, for example, knowledge. Someone can have high knowledge and can have low knowledge. Okay, so you can improve the person's knowledge as well, reduce the person's knowledge. So when there is increase in knowledge, there tends to be changes. And when there is a reduced knowledge about something, there tends to be changes. So in a nutshell, independent variables represent the factors being studied, whereas the independent variable represents the outcome being what measured. The outcome being what measured. What we mean by outcome being measured, when we started the example above using family planning, we said that we want to take the knowledge of somebody towards family planning. Now, when the person is uninformed about family planning, his knowledge towards family planning will be reduced, right? So that part, that factor that receives the effect of the independent variable is known as a dependent variable. What we're trying to say is that the dependent variable from the name depends on the independent variable. So if there's any manipulation in the dependent variable, in the independent variable, the dependent variable will receive the effect. If you increase it, it changes. If you decrease it, it changes. So the dependent variable is the variable that receives the effect. The other set of variable is the confounding variable. The confounding variable. These variables, they are like an intermediary between dependent and independent variable. The confounding variable can modulate the effect which the independent variable has on the dependent variable. Let's say you want to establish a relationship between cigarette smoking and cancer, mainly in analytical research. Why you want to establish a relationship between cigarette smoking and cancer. Let's say I want to find out if people who smoke more have higher chances of coming down with cancer. If now in that example, the smoking is the independent you are manipulating, coming down with cancer is the dependent variable. Now, if you want to carry out such research, you must control for confounding variables. These confounding variables, for that example we give, can be age. The more someone grows older, the higher chances of the person coming down with cancer. So you cannot, because you carry out a research to assess the relationship or to explore the relationship between cigarette smoking and cancer. And let's say after the cohort studies, you were able to the participants came down with cancer, you cannot conclusively say that there is a relationship between smoking and cancer, except if this confounding variable, like age, that we gave as a sample, is being controlled. Because we know as one goes older, one has high chances of what? Coming down with cancer. So you have to, so in order to control the confounding variables, you need to randomize. Okay, but that's beyond the scope of these lectures. Now let's use example to explain further. Factors influencing the utilization of primary healthcare facilities in Ubomiri in Imbito local government of Imo State. Looking at this research topic now, we have the independent variable, which is obvious already. The factors. So the independent variable here is the factors influencing the utilization of primary healthcare facilities. What are these factors? It could be distance to the facility. It could be availability of healthcare professionals. It could be cost of services. It could also be cultural belief. So you see, so where the culture is against utilization of primary healthcare facility, the people who have low utilization. Where the culture influence the way they think about modern medicine, there will be low utilization. So, but where the culture supports it, there could be higher utilization. Distance of facility. When facilities are around vicinity or around where people live, people tend to make use of it. Or in the other way around, or in the other hand, if it is far, there is high chances of what? Low utilization. So if these factors, if it's in the favorable form, there will be increase in utilization. See why I say factors are in this research topic now. Factors is the independent variable, because if the facility is closer, people tend to use it more. If there are available healthcare workers, people tend to go there because they'll be giving services they needed. But where there is no doctor, no nurse, no community practitioner, no other healthcare workers, lack of equipment, all of that, people may tend not to go there. So you see how factors is an independent variable here, which is being what? Measured. But that's what you are measuring now. Which is what we are being assessed. We're trying to assess the influence of factor on utilization. And here, utilization is the dependent variable because any change in the independent variable has effect on it. When the facility is closer, there's higher utilization. When the facility is low, there's low utilization. Okay, so in the research topic, the independent variable is the factors, while the dependent variable is the utilization. So let's take it again. Independent variable in this research topic, factors influencing the utilization of primary healthcare facilities in Ubomiri and Bitolo area of Imo State, is factors influencing the utilization of primary healthcare facilities. So factors is the independent variable here. The independent variable in this research topic refers to the various factors that may influence the utilization of primary healthcare facilities. These factors can include distance to facility, availability of healthcare professionals, cost of services, and cultural belief. Then dependent variable. The dependent variable for this research topic is utilization. So the dependent variable is the utilization of primary healthcare facilities in Ubomiri, which is the outcome or response variable that is being what? Measured or observed. So that is the one you are seeing. You may not see the factors, but they are there. But what you see is the effect on utilization. So they could either have low utilization or have low utilization, and that makes it a dependable variable. Then confounding variable. This includes socioeconomic status of the individual, educational level, availability of transportation, and accessibility of healthcare information. So they are the confounding variables here. They can modulate the effect. So therefore, if you don't control for them, you may come up with erroneous relationship that these factors are actually affecting the utilization. A confounding variable is an extraneous factor that is related to both the independent and dependent variable in the study. It can influence the relationship between these variables and create a false or misleading association. Converting variables can lead to inaccurate conclusion and hinder the ability to establish a cause and effect relationship. So what we mean by a cause and effect relationship is that we are saying that these factors are actually the cause, whereas the outcome, which is being measured, is the effect. There is the facility is far away, it is the cause. Then the effect is utilization. So the cause is the independent variable, which is the factors, while the dependent variable is the effect that is, or the factor that is being measured. So that is what confounds. So confounders modulate. So if you don't control them, you will come up with coming up with the wrong association that this is related to this, whereas that is not true. Like when we cited example using smoking and lung cancer, and age is a confounder. Okay. When conducting research, it is crucial to identify a control for confounding variables to ensure that the relationship between the independent and dependent variable is accurately assessed. Controlling for confounding variables involves either eliminating their influence or statistically adjusting for their effect. Consider the following example to understand the importance of controlling for confounding variables. Suppose a researcher wants to investigate the relationship between coffee consumption and the risk of heart disease. The independent variable is coffee consumption, and the dependent variable is the risk of heart disease. However, there might be confounding variables such as age, smoking habits, and exercise level that are associated with both coffee consumption and the risk of heart diseases. If the researcher fails to control for these confounding variables, the observed relationship between coffee consumption and heart disease risk may be distorted. For instance, if older individuals tend to drink more coffee and are also at higher risk of heart disease, the relationship between coffee consumption and heart disease risk may appear stronger than it is actually. In this case, age acts as a confounding variable. So to accurately assess the relationship between coffee consumption and heart disease risk, the researcher needs to control for confounding variables. This can be done through various methods, such as randomization, matching participants based on relevant characteristics, or statistical technique like regression analysis. But this is beyond the scope of this lecture. These variables other variables, other confounding variables also include socioeconomic status of the individual, educational level, availability of transport, accessibility of health care information. It is important to consider and control for these confounding variables to ensure that relationship between the independent and dependent variable is accurately assessed. Okay. So using our example above, the independent variable in the research topic, factors influencing the utilization of primary healthcare facilities in the Ubomini community, is factors influencing utilization of primary healthcare facilities. These various factors include distance to health facility, availability of healthcare professionals, cost of services, cultural belief. It is considered the independent variable because it is the variable that is being manipulated or controlled by the researcher. The researchers are interested in studying how these factors influence the utilization of primary healthcare facilities. The independent variable is in this research topic is utilization of primary healthcare facilities in Ubomiri. This variable represents the outcome or the response that is being measured or observed in the study. The researcher wants to understand how the various factors mentioned above influence the utilization of primary healthcare facilities in the Ubomiri community. By studying the utilization rates, they can assess the impact of the independent variables on the dependent variables. So what this is trying to explain is that the researcher is interested on both variables because he tried to study the independent variable, he tried to manipulate. Then he tried to also see the effects on the what dependent variable, which is the utilization rate. That was how does these factors, such as cost of services, healthcare provider, influence the utilization rate? And the utilization rate is what is being what observed or seen, whether the person going to the health facility or not. Now, the confounding variables in this research topic are socioeconomic status of the individual, educational level, availability of transportation, and accessibility of healthcare information. These variables are considered confounding variables because they have the potential to influence the relationship between the independent variable and the dependent variable. For example, individuals with higher socioeconomic status or better education might have better access to healthcare facilities, regardless of factors being studied. You see, someone who is educated tends to have, like someone who has higher health literacy level would tend to use facilities more than another person who do not have such level. So it's more, so because someone has a higher utilization rate, you must exclude confounding variables before you can establish that this factor, cost of services, affects utilization rates. Let's say someone who is educated, education is a confounding variable. Because he is educated, he or she understands that once he or she is unhealthy, that he needs to go to the hospital. So when he gets there and the cost of services are high, he or she, because of his educational level, would pay. Unlike someone who does not really believe that going to hospital is necessary, how much more when he gets there and the hospital cost is exorbitant, he run away. So we will not have to remove this educational level or economic status so that we will be on a neutral ground and see, actually cost of services are also can lead to low utilization. So we must remove these barriers known as, or modifiers known as what? Confounding variables. Let's take another example. Knowledge and attitude of women of childbearing age towards exclusive breastfeeding. The independent variable here is knowledge and attitude. This knowledge and attitude is what is being studied, and that is the what? The independent variable. The dependent variable is women's behavior. Woman's behavior regarding exclusive breastfeeding. Whether the woman is giving breast milk or not giving the breast milk. So we're trying to find out how does his knowledge about breast milk or his attitude or her attitude, towards exclusive breastfeeding, how does it affect her practicing exclusive breastfeeding, giving breast milk exclusively? How does it affect it? How does it relate? We're trying to develop the relationship. Is there any relationship, like someone who is well knowledge about breastfeeding, that they tend to give breast milk exclusively? We want to establish that relationship. We want to come to conclusion. You understand? We want to come to conclusion that knowledge of breastfeeding affects woman breastfeeding exclusively. We want to come to that, or we want to come to the conclusion that whether you have the knowledge or not, it doesn't affect exclusive breastfeeding. So now, the exclusive breastfeeding is the practice that is being seen, that is being measured, that is being observed, and that is the dependent variable. Whereas the knowledge, we don't see the knowledge, but we can assess we can manipulate the knowledge and attitude that is now having an effect on the behavior known as exclusive breastfeeding. Now, what is the confounding variable? The confounding variables include socioeconomic status, cultural belief, access to breastfeeding support, and educational level. So I've explained this in the previous slide. This confounding variable can either modify what we are finding or not. Can either make it give us a false reason. Let's say someone whose brothers or whose elder sister breastfed exclusively. Whether the person has the knowledge or not, he or she will definitely exclusively breastfeed the child because the elder sister did it and she saw the outcome. So breastfeeding support can be a confounding variable. and therefore can alter our studies. Because we're trying to study if knowledge and attitude can have impact on the practice known as exclusive breastfeeding. So in this research topic, the independent variable is the knowledge and the attitude of women of childbearing age towards exclusive breastfeeding. This variable represents the factor that influence women's understanding of exclusive breastfeeding. The dependent variable is the behavior of women regarding exclusive breastfeeding, which is the outcome variable being observed or measured. The confounding variable in this case can include socioeconomic status, cultural belief, access to breastfeeding support, and educational level. These variables may influence both the independent variable, that is the knowledge and attitude, and the independent variable, the behavior, and need to be considered to accurately assess the relationship between them. Further explanations. The independent variable in a research study is the variable that is manipulated or controlled by the researcher. In this case, that is this example, the independent variable is knowledge and attitude towards exclusive breastfeeding. This means that the researcher is interested in examining how the level of knowledge and attitude towards exclusive breastfeeding influences women's behavior regarding exclusive breastfeeding. The choice of knowledge and attitude as the independent variable is based on the assumption that these factors can have significant impact on women's decision-making process regarding exclusive breastfeeding. It is believed that women who have a higher level of knowledge and a positive attitude towards exclusive breastfeeding are more likely to engage in the behavior of giving breast milk to their infants exclusively. On the other hand, the dependent variable in this research topic is women's behavior regarding exclusive breastfeeding. This variable is the outcome or response that is being measured or observed in the study. In this case, the researcher is interested in determining whether women are giving breast milk exclusively or not. So the choice of women's behavior as the independent variable is based on the assumption that it is influenced by their knowledge and attitude towards exclusive breastfeeding. By measuring women's behavior, the researcher can assess the impact of their knowledge and attitude on the actual practice of exclusive breastfeeding. Lastly, the confounding variable. The confounding variables are factors that may influence the relationship between the independent variable and dependent variable. In this research topic, the confounding variable includes socioeconomic status, cultural belief, access to breastfeeding support, and educational level. For example, women with higher socioeconomic status or better access to breastfeeding support may have more resources and information available to them, which could influence their knowledge, attitude, and ultimately their behavior regarding exclusive breastfeeding. Similarly, cultural beliefs and educational level can also play a role in shaping women's knowledge, attitude, and behavior towards exclusive breastfeeding. Let's take another example. Knowledge and attitude and use of long-acting contraceptives among women of childbearing age in the Ubomiri community. The independent variable, that is the variable that we are interested to measure, is knowledge, attitude, and use. Okay, we're trying to measure it. We're trying to measure the knowledge, attitude. Okay, whereas the dependent variable is women's utilization of long-acting reversible contraceptives. Utilization, because the knowledge and attitude can influence utilization. Whereas the confounding variables are socioeconomic status, cultural belief, access to contraceptive services, and educational level. In this research topic, the independent variable is the knowledge, attitude, and use of long-acting reversible contraceptive among women of childbearing age. This variable represents the factor that influences women's understanding, perception, and utilization of lack. The dependent variable is the woman's utilization of lack, which is the outcome variable being observed or measured. The confounding variables can include socioeconomic status, cultural belief, access to contraceptive services, and educational levels. These variables influence both the dependent and independent variables. Another example. This research topic, health and environmental implication of flooding in Ubomiri. The independent variable here is flooding. While the dependent variable here is health and environmental implications. Whereas the confounding variable here is infrastructure, population density, waste management system, emergency response. In a community where they have an emergency response, once there's flooding, the effect of flooding will be mitigated. Where there's adequate waste management, effect of flooding will be reduced. So therefore, for us to conclude that the relationship between flooding and health implications on health and environment, flooding implication on health and environment, we must control for waste management. We must control for waste management. Are these people actually having a good waste management system, or are they not having? How do we remove good waste management system and bad waste management system for us to establish that there's a relationship between flooding and health and environmental implications? So in this research topic, the independent variable is flooding in Obomiri, which represents the occurrence and severity of flooding events. The dependent variable is the health and environmental implications of flooding, which refers to the impact on human health and surrounding environment. The impact this flooding has on human health and surrounding environment. The confounding variables include infrastructure, population density, waste management system, and emergency response capabilities. These variables may influence both the independent variable, known as the flooding, and the dependent variable, known as health and environmental implications, and needs to be considered accurately for us to establish a relationship between these independent and independent variable. Explanations. In the research, health and environmental implication of flooding in Ubomiri, the independent variable is flooding in Ubomiri because it is a variable that is intentionally manipulated or controlled by the researcher. That is, increase in flooding or decrease in flooding would have impacts. In this case, the researchers are interested in studying the effect of flood on health and environment in Ubomiri. The dependent variable is health and environmental implication because it is the variable that is being measured or observed to determine the effect of independent variable. The researchers want to understand how flooding in Ubomiri affects the health of the population and the environment in terms of pollution, disease outbreak, damage to infrastructure, etc. The confounding variables, like we said earlier, include infrastructure, population density, waste management system, emergency response capabilities. These variables are potential factors that can influence the relationship between the independent variables, flooding, and the independent variables, health and environmental implications. They are considered confounding variables because they may have an impact on the outcome being studied, but are not the main focus of the research. Infrastructure such as roads, building, drainage system can affect the severity of flooding and the ability to respond to it. Population density can influence the vulnerability of the population to flooding. Where there are much people compacted within a small space and people are compacted, they will block the drainage system. So any little flooding will be disastrous to the environment and will likely cause disease outbreak among that people that are clustered. So would you not say that flooding has anything when you have not controlled this population density? Also, do that the same research in a population where there's scattered, people are scattered, and where there's good drainage system, and see the outcome before you can conclusively say flooding has impact on the environment. So that's what confounding variables are all about. So you must confront them. Then waste management system can impact the spread of disease and pollution during and after flooding events. Emergency response capabilities can determine the effectiveness of rescue operations and the provision of healthcare services. For example, you wouldn't say that flooding don't cause disease outbreak or cause disease outbreak when you haven't minimized the effect of effective or ineffective emergency response. So for you to really come up to that point, you must carry out the research in such a way that both effective and ineffective management response don't have influence. So that emergency response is a confounding variable. Another research topic is prevalence of diarrhea among children attending Holy Angels Nursery and Primary School in Anambra State. The independent variable is attendance at Holy Angels Nursery and Primary School, whereas the dependent variable is the prevalence of diarrhea among children. Now, why is attendance the independent variable? It is what we are trying to study. How does someone attending this school, a child attending this school, increase or contributes or reduce to the existence of diarrhea among these children? A child coming to that school, how does it either increase or decrease the diarrhea incidence in that school? Whereas the prevalence, that is the existence of a particular disease condition in a particular population, is a dependent variable. The confounding variables here include those things that can modify diarrhea occurrence, such as hygiene practices, water quality. It could be that it's the water that the children are taking in that school that are contributing to them coming down with diarrhea, and not actually the attendance of the students. It could also be that it is the coming of new students that is contributing to this diarrhea. But however, we need to rule out hygiene practices. We must provide a situation whereby both hand washing and lack of hand washing don't have effect. Whether you have wash your hand or you don't wash your hand, that your chances of coming to diarrhea is still 100% as far as you are attending school. For us to establish that there is a relationship between attendance at Holy Angels Nursery and Primary School and existence and prevalence of diarrhea among the school children. In this research topic, the independent variable is attendance at Holy Angels Nursery and Primary School, which represents the population being studied. The dependent variable is the prevalence of diarrhea among children, which is the outcome variable being observed or measured. The confounding variables, like we say, include hygiene practices, water quality, and all of that. These variables may influence both the independent variable, that is attendance to the school, and the dependent variable, prevalence of diarrhea, and need to be considered to accurately assess the relationship between them. The independent variable in the research, prevalence of diarrhea among children attending Holy Angels Nursery and Primary School, is attendance at Holy Angels Nursery and Primary School, which is being studied. This variable is considered independent because it is the factor that the researchers are manipulating or controlling. They are interested in studying the relationship between attending this specific school and the prevalence of diarrhea among children. The dependent variable in this research is prevalence of diarrhea among children. This variable is considered dependent variable because it is the outcome or result that the researchers are measuring or observing. They want to determine how attending Holy Angels Nursery and Primary School may be associated with the prevalence of diarrhea among children in the school. Okay, so now the confounding variables, like we said earlier, are considered because they have the potential to influence this relationship. Like we said earlier, hygiene practices such as hand washing habits can affect transmission of diarrhea diseases. Water quality, including the presence of contaminants or pathogens, can also contribute to the occurrence of diarrhea. So it could be that the water that is being used in that school is a factor. So we must rule out water by controlling the confounding variables. Also, nutritional status plays a role in the overall health and immune system, which can impact susceptibility to diarrhea. A child might come with the diarrhea. Another child may not come down with it because that child has immunity. So that does not mean that there's no relationship existing with attending to the school and the prevalence of diarrhea. So we must also control for nutritional status. So in a nutshell, we've been able to look at variables using different research topics. And in summary, the independent variable represents the factor being studied. The dependent variable represents the outcome being what? measure, which means the one you are studying, that is the one you are manipulating. And the one you are manipulating is the independent variable, which is the one you are studying. Then the dependent variable is the one that is measured, that is the outcome. When you manipulate this one, what happens to this? When you manipulate the independent variable, what happens to the dependent variable? So then the confounding variable represents additional factors that can influence the relationship between the independent and dependent variables. So I believe we've been able to look at these factors critically. Thank you, and God bless you.